friends and supporters at the Helmsley Trust, I wanted to thank you personally for your generous donation for the struggle with the coronavirus. I also wanted to share with you the excellent news of successful treatment which was given to the first and most severe patient with COVID-19 who was diagnosed with acute pneumonia and admitted to the medical center. Treating him was the great challenge of our medical staff. He was admitted to a negative pressure room under induced coma with artificial respirations. And intensive care unit physician volunteered to accompany the patient personally, as well as a nurse. Thanks to the excellent care he received at our medical center, he went back to his family, wife and 3 kids just a week ago.
Our existence as emergency medicine healthcare providers has changed in the age of coronavirus. On a daily basis, we treat patients, often performing life-saving procedures with no way of knowing if the patient before us is infected. We are placed in danger on a daily basis of infection, becoming vectors of disease to our patients, to our families, and becoming ill ourselves. For us, protective gear is life. The hospital's supply is dwindling under the immensity of our needs as emergency healthcare workers. We would appreciate any source of outside help.
And this is where we took care of the first severe COVID-19 patient in Israel. He was discharged home exactly a week ago, after he spent about 3.5 weeks with us. He was ventilated, he was in ICU for over 12 days, and happily he recovered and went home. And he's doing great. Had quite a challenging month this March 2020, and we have lots of long and challenging weeks and months ahead of us. It's not always easy to work in an environment like this, wearing all the protection equipment and knowing that no matter how safe we try to be, there is always the risk of getting infected with the coronavirus, with our families back home waiting for us.
Working with the patients is actually very rewarding. It's a little bit difficult because we're dressed in hazmat suits with masks and they can't really tell who we are, so the only tool we have is our voice. We can only try to bridge the gap between them with our voice. We try to be as warm as possible to ask them as many personal questions as we can. Many of the patients are struggling with loneliness, they're struggling with homesickness. Beyond the cough and the unknowing what is going to happen, when am I going to go home, have I infected anyone? They're dealing with a lot of issues. It's quite complex in there. So we do, beyond the regular nursing activities, we do a lot of conversation. We try to meet their physical needs, if they need a toothbrush, if they need to learn how to use Amazon Prime so they can watch movies, all kinds of little details that you would not normally consider part of a nurse's au revoir. We're doing them because we're the only ones that they have contact with at the moment.
Your gift makes it possible to treat many more with severe symptoms of COVID-19, and thanks to the advanced medical treatment of our staff, we hope for similar results in future. We hope you and those close to you are staying safe, healthy, and well.